Sudden cardiac death is caused by a loss of heart function. It's the most common form of natural death in the U.S., resulting in about 325,000 deaths each year. Dr. Roger Duber of San Antonio Hospital in Upland explains diagnosis and treatment.
Sudden death most of the time is due to coronary artery disease. And it may be the first symptom that one ever has for coronary artery disease. And that's usually because there's a plaque within the artery wall that ruptures, induces clot formation, and all of a sudden there's a portion of the heart muscle not getting any blood flow at all. And the first response by the heart muscle is irritability, where it starts becoming very irregular, causing what is called ventricular fibrillation, where all of a sudden the heart muscle fibrillates and does not contract, and there's no blood flow getting out of the heart, and someone will die very quickly, within the matter of seconds. The diagnosis of coronary artery disease is quite dependent upon how it presents itself. Many patients have no symptoms at all, and we rely upon the primary care physician to identify those patients who are at high risk and refer those patients to places such as the San Antonio Heart Center, where we have a variety of imaging techniques that can identify whether there is coronary artery disease and whether one is at increased risk for having a significant event like a heart attack. Those who we identify to have serious obstructive lesions in the arteries of the heart frequently are referred to our cardiac catheterization team, where they undergo coronary angiography, where we can accurately visualize the obstructions and see if intervention is necessary. The treatment is essentially dependent upon two things. One is how the patient manifests themselves, whether he's having symptoms or not, and the second is the extent of the obstructive lesions in the arteries of the heart. Many times patients will have no symptoms and only have mild obstructive lesions. Those kind of patients, we encourage very vigorous primary prevention therapy. Those patients who have stable symptoms with serious obstructive lesions frequently will require a more vigorous treatment, such as coronary angioplasty, usually with stents, or coronary artery bypass graft surgery. More than 300,000 people in this country a year present with heart attacks, and those patients require very aggressive, rapid therapy. Our goal, however, is to return the patient to a normal lifestyle that was as good, if not better, than the one they had before they came into the hospital. Now that consists, first of all, of our cardiac rehabilitation program that we have here, where patients are entered into our exercise program under the observation of experienced and trained nurses that work with the patients several times per week, not only with exercising, but in instructing them in diet and lifestyle changes that are essential to keeping these patients as healthy as possible for the remainder of their lives.